What is good health? The word health refers to a state of complete emotional, mental, and physical well-being. People may be able to maintain or improve their health by eating a balanced diet, exercising regularly, and connecting with others. Healthcare exists to help people maintain or improve their mental, emotional, and physical well-being. Good health is central to handling stress and living a longer, more active life. According to the Centers for Disease Control and Prevention (CDC), healthcare costs in the United States were $3.80 trillion trusted source in 2019. However, despite this expenditure, people in the United States have a lower life expectancy than people in other developed countries. This is due to various factors, including access to healthcare and lifestyle choices. A 2021 commentary expands on this, suggesting that good health requires the ability to adapt when coping with stress. The commentary's authors indicate that environmental, social, and personal factors can affect health. They also suggest that health is multidimensional, dynamic, and continuous. It may be distinct from a person's ability to function and instead determined by adaptation and balance, which allows for considerations of health within a context of disability. Types of health. Mental and physical health may be the two most frequently discussed types of health. However, health is a multidimensional concept. Spiritual, emotional, and financial health may also contribute to overall health. For example, people with better financial health may worry less about finances and have the means to buy fresh food more regularly. Those with good spiritual health may feel a sense of calm and purpose that fuels good mental health. Health equity resources. Visit our dedicated hub for an in-depth look at social disparities in health and what we can do to correct them. Physical health. Someone with good physical health is likely to have bodily functions and processes working at their peak. This is not only due to an absence of disease. Regular exercise, balanced nutrition, and adequate rest all contribute to good health. People receive medical treatment to maintain the balance, when necessary. Physical well-being involves pursuing a healthy lifestyle to decrease the risk of disease. For example, maintaining physical fitness can protect and develop trusted source the endurance of a person's breathing and heart function, muscular strength, flexibility, and body composition. Looking after physical health and well-being may also involve reducing the risk of an injury or health issue. Examples include minimizing hazards in the workplace, using a condom or other barrier methods when having sex, practicing effective hygiene, avoiding the use of tobacco, alcohol, or illegal drugs, taking the recommended vaccines for a specific condition or country when traveling. Good physical health can work with mental health to improve a person's overall quality of life. For example, a 2021 study highlights an association between mental health disorders and substance use disorder. Mental health. According to the Substance Abuse and Mental Health Services Administration, trusted source mental health refers to a person's emotional, social, and psychological well-being. Mental health is as important as physical health as part of a full, active lifestyle. It is harder to define mental health than physical health because many psychological diagnoses depend on an individual's perception of their experience. However, research is ongoing to identify some physical signs of some types of mental illness in PET scans, MRI scans, and genetic tests. Good mental health is not only categorized by the absence of depression, anxiety, or other disorders. It also depends on a person's ability to enjoy life, bounce back after challenging experiences, and adapt to adversity, balance different elements of life, such as family and finances, feel safe and secure, achieve their full potential. Physical and mental health have strong connections. For example, if a chronic illness affects someone's ability to complete their regular tasks, it may lead to depression and stress. These feelings could be due to financial problems or mobility issues. A mental illness, such as depression or anorexia, can affect body weight and overall function. It is important to approach health as a whole, rather than as a series of separate factors. All types of health are linked, and people should aim for overall well-being and balance as the keys to good health. Factors for good health. Good health depends on a wide range of factors. Genetic factors. People are born with a variety of genes. In some people, an unusual genetic pattern or change can lead to a less than optimum level of health. People may inherit genes from their parents that increase their risk for certain health conditions. Environmental factors. Environmental factors play a role in health. Sometimes, the environment alone is enough to adversely affect health. Other times, an environmental trigger can cause illness in someone with an increased genetic risk of that disease. Access to healthcare plays a role, but the WHO trusted source suggests that the following factors may have a more significant impact on health: where someone lives, the state of the surrounding environment, genetics, their income, their level of education, relationships with friends and family. It is possible to categorize these as follows. The social and economic environment. This may include the financial status of a family or community, social culture, and the quality of someone's relationships. The physical environment. This includes which germs exist in an area, as well as pollution levels. Characteristics and behaviors. A person's genetic makeup and lifestyle choices can affect their overall health. Socioeconomic status. A person's socioeconomic status, SES, encompasses trusted source their education, type of job, and income. According to some research, the higher a person's SES, the more likely they are to enjoy good health, have a good education, get a well-paid job, and afford good health care in times of illness or injury. People with lower SES may also be more likely to experience stress, for example, due to financial difficulties and unemployment. Social factors, such as marginalization and discrimination, may also affect the risk of adverse health outcomes for people with lower SES. A low SES often means reduced access to health care. A 2018 study indicated that people in developed countries with universal healthcare services have longer life expectancies than those in developed countries without universal healthcare. Lifestyle factors. In the 7-country study, researchers studied people in select European countries and found that those who ate a healthy diet, such as the Mediterranean diet, had a lower all-cause death rate. A 2024 reviewTrusted source associates diets high in ultra-processed foods with adverse health outcomes, including all-cause death due to cardiovascular disease, mental health conditions, type 2 diabetes. How someone manages stress may also affect their overall health and well-being. The CDC trusted source recommends taking care of the mind and body with techniques such as connect with others, practice gratitude, avoid alcohol and illegal drugs, get enough sleep, exercise, maintaining a healthy diet, staying on current preventive health maintenance.